All right, welcome back to another audio lecture. In this audio lecture, we're going to be covering disorders of white blood cells, focusing on neutropenia. Neutropenia is a decrease in neutrophils. It's a type of leukopenia. So leukopenia is a decrease in the number of leukocytes or white blood cells. Okay, neutropenia is a specific form of leukopenia. So remember that neutrophils are involved in stopping bacterial infections. They are your first line of defense against bacterial infections. Okay? And so neutropenia develops when neutrophils drop less than 1,500 cells per microliter. Okay? Whereas the normal cell count is 2,000 to 7,500 cells per microliter. Okay? This leaves the individuals susceptible to a bacterial infection. Okay? So because your first response is compromised. So these are all bacteria, and here's your neutrophil. Remember, it's a multi-lobed leukocyte with a very conspicuous nucleus. It is granulated. And so in response to bacteria getting inside the body, and it's usually in the interstitial space, okay, the neutrophils are attracted to the area by chemoattractants, okay, following through chemotaxis. Okay. Now, it is in the sites that neutrophils undergo phagocytosis, okay, and then they end up pretty much committing suicide because they release bleach and hydrogen peroxide inside of their cell. And not only does that destroy the bacteria, but it also destroys their organelles as well. Okay. So causes of neutropenia, it could just be due to an increased activation of the immune system. So if you have a constant bacterial infection, essentially, this can be decrease the amount. So if you use the neutrophils and then you're constantly calling on production of neutrophils, well, eventually the body can't keep up with it. Right? Immunosuppressant therapy, so anything that would depress your immune system would lead to a lower level of neutrophils. Okay? Radiation therapy is kind of along the same lines. So radiation therapy, depending on where it is at, the radiation kills healthy cells, kills all cells really. So if you're going in for radiation therapy for cancer treatments, this cancer treatment can have negative effects on your blood cells. Okay? And then we could have congenital neutropenia. Okay? The example of this is cyclic neutropenia, in which you have periodic days, okay, in which you decrease the number of neutrophils that are circulating. So you get spikes, and then they are interspersed with a few days. So each one of these spikes is 5 days. So 1, 2, 3. So you have almost 3 weeks of a gap here of low levels of neutrophils before your immune system kicks it back up. Okay, so only focus on this top figure for cyclic neutropenia. Okay. Bone marrow cancer. So the cancer itself can decrease the number of neutrocytes, but also the treatment for bone marrow cancer can reduce that as well. So radiation therapy, spleen damage, and then vitamin deficiency. So if you don't have the correct vitamins, that oftentimes are important in the cofactors. So taking pills, vitamins and pills is not completely necessary. Just eating a healthy diet, making sure you're getting all the necessary components that you need to. Okay. Can reduce this vitamin deficiency, but if you are lacking any of the resources, then production of neutrophils is going to be decreased. So manifestations of neutropenia are going to include signs and symptoms of bacterial and fungal infections, right? So malaise, chills, fever, anything that would indicate that you have an infection. So malaise is general ill feeling. Okay? These are ulcers, so here's the ulceration of epithelial tissue, and these are mouth sores because of neutropenia. Now, one other thing that you see here is that if you think, so we haven't gotten to the AIDS lecture yet, but you'll see something pretty similar in this, in that this can be bacteria or yeast, but this, it looks like carpet almost, and the bacterial growth can grow on the tongue because we have a lot of bacteria in our mouth, and if we don't have a healthy immune system, the bacteria can become overwhelming on the tongue. Right? So we get ulceration of epithelial tissue, and this is of the oral cavity, but we could also get it in the vagina or the gastrointestinal tract. So vagina would only apply to females, obviously. How are you going to diagnose neutropenia? Okay. You measure the serum neutrophil concentration, so the neutrophils in circulation, and then you may need to do a bone marrow assay to determine the cause. So, and they might find bone marrow cancer in there as well. Okay, the treatment is going to be fairly obvious. So you would use antibiotics to take care of any bacterial infection, and then you would deliver hemopoietic growth factors, right, to stimulate the precursor cells inside the bone marrow to produce more neutrophils. So if this is kind of an important one, but it's not. This neutropenia would leave you immunocompromised and leave you susceptible towards bacterial infections. Okay, so here's the hot wash for neutropenia. And first of all, you need to tell me what neutropenia is. Okay. What type of infection are you more susceptible to if you develop neutropenia? One note about neutropenia, I want to point out there's a discrepancy in the book, and that the normal concentrations are not 1,500 cells per milliliter, but it is per microliter, as I pointed out in my lecture. Okay, so I didn't make a mistake in my pronunciation there. So it is a 1,500 cells per microliter is the normal value, and then we get less than, or 2,000 to 7,000 cells per microliter, and then neutropenia is defined as fewer than 1,500 cells per microliter. Okay, you should be able to identify the causes. Okay, remember that anything that uses neutrophils is going to deplete the amount of neutrophils that you have available. Okay, so go through the different causes and make sure you understand why the causes are such. Manifestations are pretty straightforward, and then diagnostic procedures in addition to the treatment of neutropenia. Right? That is it for this audio lecture. Until next time.